So, welcome back to Long Covid Doctor, an educational series for sufferers of long Covid. This is the second part of my talk on breathlessness and long Covid. In the first part, I talked about the symptoms, the diagnosis, the investigations, and the pathology. And in this part, part two, I'll talk about the treatments, management, and the outcomes. References, links, and resources are in the show notes below. And as I said before, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own GP or qualified health professional. So here we go, part two on breathlessness and long Covid. So, like I said, let's start first of all with the treatment. So what is the specific treatment, the management of long Covid breathlessness? Well, firstly, treatment of any of the conditions discovered through the history examination and blood tests that I outlined in the first part. So any of those conditions, those differential diagnoses need to be sort of treated initially. Maybe the patient who has asthma or COPD, their treatment needs to be optimized. So inhaler technique or sort of the dosage of their medication thought about and talked about with the GP and then actioned. Maybe as a result of the history examination, the patient needs to be referred on to specialist hospital services, so where appropriate. So the second part of the sort of the management of the long Covid breathlessness would be sort of to address those other symptoms that the patient may have with their long Covid. So the patient may have chest pain, which has been put down to pleuritis, having had sort of other causes, so cardiovascular causes for their chest pain excluded. So if it really is chest pain because of their Covid grip, those patients probably need or certainly benefit from colchicine, which is very effective at dealing with the discomfort of pleuritis. Those patients may have other cardiovascular problems such as postural orthostatic tachycardia syndrome, POTS, part of the dysautonomia problem. So those patients will need and probably benefit from a medication such as beta blocker, or indeed they may need referral on to a cardiologist. Another common symptom in our long Covid patients are patients who have mast cell activation syndrome symptoms. So they may benefit from H1, H2 blockers, so antihistamine H1 such as fexofenadine, or antiacid H2 blockers such as famotidine. So these are prescribed off-label, unlicensed. Your GP may feel comfortable with this, they may not. But these are treatments that will help those other long Covid symptoms. Other long Covid symptoms such as joint pains should be treated, or patients who have headache, migraine, maybe they need a course of amitriptyline to help with that. So now on to the management of long Covid breathlessness more specifically. In particular, breathlessness due to deconditioning and breathlessness due to breathing pattern disorder. So firstly, breathlessness due to deconditioning. So anyone who's been unwell, so after they've had their prolonged Covid illness, they've probably been underactive and had unavoidable rest. That can make them a bit deconditioned. So referral to a musculoskeletal physiotherapist will help them get reconditioned. And then secondly, breathlessness due to breathing pattern disorder. So a referral to the respiratory physiotherapist, either in the Long Covid clinic that you may well have been referred onto, or a physiotherapist who is a specialist in breathing pattern disorder. So let's think about and talk about breathing pattern disorder a little more. What is breathing pattern disorder? Well, basically, normal, natural breathing rhythm is slow and deep. 80% of our breathing takes place through the action of the diaphragm muscle, that is the muscle between the chest and the abdomen. That's so-called abdominal breathing. That's very different from abnormal, unnatural breathing rhythm, which is fast and shallow. This is through the action of the accessory muscles of respiration. So the neck, the shoulders, the shoulder girdle, and the rib cage. This is so-called thoracic or chest breathing. This is, as I've said, unnatural, and it leads to sort of an over-breathing or hyperventilation. And it is more often than not usually caused by anxiety or stress, worries about health or family or job or bereavement. Obviously, our long COVID sufferers have lots of that worry going through their minds, and understandably so. But unfortunately, this all contributes to breathing pattern disorder. So how can we control our breathing pattern disorder? That's the question. We need to learn strategies of breath control. Normally, we don't have to think about breathing, do we? Breathing happens automatically, subconsciously. But if you have got it into a bad habit of breathing pattern disorder, you need to, if you like, to be retrained or to be trained by a respiratory physiotherapist or yourself in breathing. We need to take control of the breathing cycle to relearn the normal breathing, as I said, slow, deep breathing. That's normal inhalation, normal exhalation cycle. In order to do this, one can sort of, if you like, train yourself, coach yourself to breathe in that normal cycle. In order to do this, you could, for example, get into a comfortable sitting position with a straight back. I'll do it. I'll talk you through it. Place your hands in your lap and slowly breathe in through your nose whilst pushing your stomach, your tummy outwards. So with that breath in through your nose, push your stomach outwards. Pause for a few seconds and then slowly breathe out through your mouth. And whilst you breathe out through your mouth, pull your stomach inwards. Try to make that out breath slightly longer than your in breath. So breathing in through your nose and pushing your stomach out in that process. Pause for a few seconds and then slowly breathe out through your mouth whilst pushing your stomach, your tummy outwards. Like I said, try and make the breath out slightly longer than your breath in. Repeat that breath in, stomach out, pause, breath out, stomach in, a number of times, 10 times, 10 cycles, say. If you practice that, breathe in, breathe out, with the stomach coming out and the stomach coming in over 10 cycles, just sort of consciously trying to train yourself to breathe in that cycle. And then if you can do that regularly over those 10 cycles, you will then get into the habit of that. There are various sort of tips and tricks to learn to help with this, the sort of relearning and to deal with this breathing pattern disorder. The first is tracking the door. Okay, so it's going to sound a bit strange, but basically find yourself a door to look at. Look at the door. Look at the frame around the door. And then track your eyes around the door. So find the door frame to track your eyes around. Track your eyes along the top. Start at the top left-hand corner. And then as you track across to the right-hand corner, take a deep breath in. Okay, have you got that? Track your eyes along the top. So start with the top left-hand corner, go across to the right, and as you go from left to right, take that in-breath. And then as you track down the right-hand side of the door, down to the floor, the bottom right, breathe out. Then as you track along the threshold of the door, from the bottom right to the bottom left, breathe in. And then as you track up the left-hand side to the top left, breathe out again. And around the door, say on 10 breaths. Okay, so breathe in the top across the top of the door. The breathe in, down the right-hand side, breathe out. Across the threshold, breathe in. Across up the left-hand side, breathe out. So that's tracking the door. You're tracking around the door. Inspiration along the top, expiration down the side. Inspiration along the bottom, expiration up the left-hand side. Tracking the door. Other tips and tricks for breathlessness? Well, you can learn the following. You can learn positions to ease breathlessness while you're sitting. So you can unweight your chest by sort of, whilst you're sitting in the chair, leaning forwards with your elbows on your knees. Leaning forward with your elbows on the table. So chair up against the table, put your elbows crossed across the table, and you're unweighting your chest in that way. Then there are positions to learn to ease your breathlessness while you're standing. So lean on the chair back if you're standing, that's sort of against the side of the table, or leaning, if you're out shopping, leaning on the trolley to unweight the chest. That'll ease your breathlessness whilst you're standing. Positions to ease breathlessness whilst walking. Well, you can anchor. You basically use your arm to anchor. Basically, put your hands in your pockets. You're anchoring your chest. Okay, put your thumbs through your belt. Again, you're anchoring your chest whilst walking. That again, it unweights the chest. Okay. And then there are tips and tricks to help with breathlessness when you are moving. Okay. So whilst you're undertaking physical activities, so there are three ways. There's the pursed lip breathing. Okay. So fix your lip as if you're blowing out a candle. So blow. You're blowing you're fixing your lips in a sort of fixed, semi-closed way. You're blowing out the candle. Okay. Blow as you go. They call it blow as you go. So before you do anything, okay, so you take a deep breath in. So breathe in before you go, okay, and then breathe out as you go. Blow as you go. So breathe in before you go, and then blow as you go. Breathe out as you go. So a big deep breath before you stand up from sitting, for example. And then as you stand up, breathe out. Okay, so breathe in before you go, okay, but whilst you're sitting. And then when you're going to get up from sitting, you're breathing out as you go, breathing out as you stand up, blow as you go. And then the final trick is counting with activity. Okay, so count as you breathe in, and then count to one as you breathe in. Count to one as you breathe in, and then count to two as you breathe out. So if you're walking, for example, okay, as you're walking along and you take a deep breath in, just count one, and then as you're breathing out, count to two. 1, 2. Okay, as you breathe in, you're walking. So 1. So 1 as you breathe in, and then as you breathe out, 1, 2. As you're breathing out, breathe in, and then 1, 2 as you breathe out. So there we are. Some tips and tricks whilst you're undertaking physical activities. The pursed lip, blow out the candle, pursed lips. Second was blow as you go. Okay, breathe in before you go, breathe out as you go. And then remembering counting with your activity. Count to 1 when you breathe in, count to 2 when you're breathing out. So try practicing all those tips and tricks. Try practicing trace the door along the top, down the side, along the top, take breath in. Okay, down the side, breathe out. Along the threshold, breathe in. Up the other side, breathe out. Trace the door. And then practicing the tips and tricks for unweighting the chest. Remembering sort of the hands in the pockets for when you're moving, or unweighting the chest when you're sitting. So sort of put your arms on your thighs or on in front of the table in front of you. So lots of tips and tricks. Yeah, practice them. They will help with you managing your breathlessness. Okay. There are some resources. Again, I've put these in the show notes below. Trusted resources for long COVID breathlessness. Physiotherapy for breathing pattern disorders. Really excellent sort of short videos on breathlessness and long COVID. The British Lung Foundation, there's another link from them. There's also links for general resources for long COVID. So from the occupational therapists, there's the fatigue resource, which I mentioned in the fatigue talk. And then there's Your COVID Recovery, the NHS England website for self-help patient resource for symptoms and information on self-management. So those are the sort of, as I've said at the start, those are the specific treatments for dealing with long COVID breathlessness. But I think it's also equally important, and I've mentioned this in other talks, this sort of the general management of long COVID. I think it's as important, because like I've said in the pathology section, there are so many causes for long COVID symptoms, and I think it's important not to be focusing on one set of symptoms in isolation. I think it's important to tackle long COVID in general terms. So that leads to the question, what else can we do to help with the recovery from long COVID? I think it's important to take the holistic view, the generalist view. We need to think of those other aspects that will help recovery from long COVID. So we've got to think about nutrition, we've got to think about sleep and mind-body. Again, I've mentioned this in other talks, but I'm going to mention it again today because I think it's so important, and you mightn't have seen the other talks. So first of all, I said nutrition, didn't I? So diet, got to think of the mixed balanced diet. The Mediterranean diet ticks all the boxes. It supplies you with all the necessary minerals and vitamins and those antioxidant polyphenols, those chemicals in vegetables and fruit that give them the different colours, the 7 colours of the spectrum for all your fruit and veg. But not only will these sort of the Mediterranean diet provide you with the minerals and vitamins, these sort of, as I said, the antioxidants and the building blocks for restoring and repair for all the sort of the normal cellular repair, tissue repair. But a mixed balanced diet will also provide you with prebiotic fibre for the gut microbiota, the friendly bacteria in our intestines, which have so many important roles in recovery in general and just general good health and well-being. They're supportive for a optimally functioning immune system, and produces all the hormones and the chemicals and the vitamins a healthy microbiota does. And then there's omega-3 fish oils for immune support, and vitamin D. Just for good measure, we live in the northern hemisphere, so we're relatively UVB starved, particularly in the winter months. Vitamin D, there's no harm in supplementing with that. Then I talked about sleep, didn't I? Sleep's so important. Sleep, as we all know, is the great healer. Sleep is a tonic. It's so important for refreshing and repairing. We must support the day-night cycle, the circadian rhythm, which is important for release of various restorative hormones. The growth hormone is the majority of the growth hormone. Most of it is released at night, controlled by the circadian rhythm. So I think it's important to think about sleep hygiene, so strict bedtime. Try not to use mobiles and tablets in the hour before turning the light off. They emit blue light, which is more arousing than reddish orange light, which is more sleep enhancing, sedating. There's no harm in if you've got sleep problems or insomnia, there's no harm in using an old-fashioned antihistamine Piriton. Magnesium, studies have shown that magnesium can enhance sleep. Melatonin, likewise, a lot of patients are buying this online. It's safe to use, it doesn't clash with other medications, it doesn't lead to dependence and addiction. I think it's important. I talked about mind-body. What do we mean by this? I think it's important to tackle, the mind and the body, how they interact. And so, mind-body strategies such as mindfulness or yoga, tai chi are very good for helping with stress and sort of anxiety and pressures and worries. I think it's very reasonable, and studies back these up as sort of helpful resources to reduce stress and worry and anxiety and also blood pressure. So certainly consider those mind-body strategies: yoga, tai chi, mindfulness. Mindfulness, there's the Headspace or Calm app, which you can download. Not expensive. Download that to your phone, and that can be used as a handy tool to help you with your mindfulness strategies. But along with all these strategies, we mustn't forget the other sort of fatigue management. Fatigue being the commonest of the long COVID symptoms, and how it impacts generally, but also worsens specific symptoms. So remember the 3 Ps: pace, plan, prioritize. Again, like I've said, I've talked about this in more fully in the in my fatigue talk. Pacing, what is pacing? Pacing is the process of balancing activity, physical, mental, emotional, with rest. Pacing gives you awareness of your limitations, and to sort of tailor your sort of activities with your capabilities with regard to your energy reserves, and planning helps you plan, how you use your energy most effectively and efficiently. So that really sort of takes care of the sort of the specific and general treatments for long COVID breathlessness and long COVID in general terms as well, as I sort of outlined. That leads us to sort of the final section, and that is on the recovery. How, the recovery, the time course, and the outcomes. What can we expect? Basically at this point, most patients, a lot of our patients, certainly in the clinics I work in, basically ask those questions. Well, how long is it going to take for me to get better? And, what does recovery look like? What's the final outcome going to be? How long will it take? First question, how long is it going to take? Well, unfortunately, it's impossible to predict because, when I first started working in long COVID, we were saying to our patients, well, it's going to take 9-12 months to get better. But now here we are 3 years on. And so patients are still suffering from, when they got it in the first wave. So, like I said, it's impossible to tell, impossible to predict how long it's going to take. The extent of the recovery, again, it's really quite difficult to predict. Hopefully the recovery will be full. That's what we all hope for. But maybe it won't be 100%. Maybe it'll be 90%, 97%, maybe 95%. Maybe it'll be partial. Maybe it'll be a sort of relapsing, remitting type of sort of recovery. You get better and then you feel 100% and then, you get knocked back again. So basically it's unpredictable what the eventual outcome is going to be. Everyone's different. Basically, improvement with this breathlessness will occur alongside natural recovery from long COVID. For this to happen, I think natural recovery from long COVID will happen with the sort of the rebalancing of all the body systems, the inflammatory system, the immune system, the glandular system, the nerve brain systems, along with rebalancing, there's going to have to be natural tissue and cellular repair. There's nerve fiber repair, sort of described this before. There's the nerves regrow. There's reconnection, rewiring due to this natural phenomenon called neuroplasticity. Those pathways in the brain will re-establish the memory pathways, the hippocampus, the sort of the executive function pathways in the prefrontal cortex. They will all be rewired, reconnected because of neuroplasticity, thankfully. And there's clearance of microclots. Yes, again, it's quite controversial. Patients are asking, well, should we be on sort of blood thinners and blood and medicines to make the blood less sticky? Well, experience really now points more towards sort of just a brief window, 6-9 months from the onset of the illness for patients to improve with those blood thinners, etc. Thereafter, blood thinners don't really make much of a difference. Again, this is being studied, internationally, but really, I think it's a case of waiting for the natural resolution to occur. So blood vessels, blood clots are dissolved eventually by natural processes, the process of recanalization. So those blood vessels sooner or later become patent again. And there's also blood vessel growth, neovascularization. So new blood vessels are created around a mini blood clot. But with nerve fiber repair and blood clots being dissolved and rebalancing of all those systems, the common denominator for all those natural processes is time. It takes time for those natural processes to work. And so you've got to give it time. But along with that, I think it's so important. You need acceptance that it's happened. You've got long COVID. Acceptance that it is going to take time, and the time frame is uncertain. You've got to accept that the time frame is uncertain, and to accept that the outcome is uncertain. It might not be full recovery, 100%. You might be 97, 94, 93%. It's impossible to predict. I think you've got to accept that may be the outcome. To accept, not to fight it, to give in to it in a way, and to give it time. So there we are. That concludes the second part of my talk on breathlessness and long COVID, following on from the first part earlier. I hope you found both of those parts helpful. Again, as I mentioned before, any advice, diagnoses, treatments that I have mentioned should be considered after discussion with your own GP or your own qualified health professional. So, in the meantime, I wish you well. I wish you well in your recovery from your long COVID.